Hey everyone, today on Future Horizons, we're joined by the wonderful Dr. Farhan, a passionate and accomplished psychiatrist whose journey in the field of medicine is nothing short of inspiring. From his years of experience caring for his patients to his dedication to continuous learning and growth, Dr. Farhan brings a unique global perspective to the future of healthcare. We're so excited to hear his insights, stories, and advice for aspiring professionals. Welcome to Future Horizons, Dr. Farhan.
Thank you so much for inviting me to your podcast.
Yeah, no worries. What inspired you to choose medicine and what ultimately drew you to psychiatry?
Well, that's an interesting question. So, from where I hail, originally from Pakistan, my mother had multiple physical health problems. She was very, very unwell all the years of me growing up. And she had this passion of a dream for me to become a doctor. Having had so many run-ins with the doctors around her, shall we say she was rather unimpressed by the care that was offered to her. But amongst that, there was a doctor who diagnosed her really well and looked after her really, really well. And that really left a lasting impression on her. And then she thought, well, I'd want my son to be like that. So as most South Asian households go, she instilled the same passion in me.
Yeah.
And as I was growing older, I was told at one point, but then also counseled many times and, steered in the direction of medicine. And as I grew up, I honestly did not know much else either. So it was a different time. Back in Pakistan, we did not have too many options known to us. And that's how it ended up, me becoming a doctor. It wasn't easy though, getting into medical college was quite difficult. And I attended Shifa College of Medicine in Islamabad, which is a very good college. We had a lovely time there. Psychiatry is more interesting in the sense that when I went into medicine as a medical student, I liked many specialties. And between my friend and I, we thought, well, we should both be gastroenterologists. One day, we wanted to be neurosurgeons, and the next, just surgeons.
Yeah.
Right? We went through different specialties in different months. But ultimately, I met a psychiatrist there in the med school in Islamabad who had a very charismatic personality, and he used to run a free clinic where he'd look after these patients who could not afford care. And he would do so out of the goodness of his own heart. In those clinics, in my summer holidays when everybody was away, I ended up volunteering and being there with him. And it opened such new avenues in my cognition that I was hooked. So, although I felt that I could perhaps do other things, and when I moved to England for postgraduate training, I initially applied in emergency medicine. But deep down somewhere I felt that psychiatry was my calling, and I had applied for psychiatry as well, and I got in. I think after a month of working in psychiatry ward, I knew that this is what I wanted to do. And yeah, years passed by and I ended up becoming a psychiatrist.
What an inspiring story. Thank you.
You're welcome.
What does a typical day look like for you as a psychiatrist?
That's a very interesting question. One of my colleagues told me before I became a psychiatrist that every day he plans his day before coming to work. And every day it doesn't go to plan. He ends up doing something different. And that's how the day in psychiatry goes for me. Because I work in various facets in a hospital. One day I'm working in the ER, other days I'm working in the inpatient ward. And some days I either work in an outpatient ward or I'm actually out on the streets looking for patients. So it is very exciting. It can be very settling at some points. It can promote lots of thoughts in your mind, and sometimes it can get quite taxing too. It's a combination. And I enjoy all parts of it. It is tiring at times, But overall, helping people, especially the cohort of patients that I deal with, it's very rewarding. Because when you see them get better, get on with their lives, live their lives to the best of their abilities, it's a very rewarding experience.
It's amazing to hear.
Yeah.
Then how do you balance personal life with work life with like the unpredictability of your schedule?
Well, I'm lucky in that sense, and one of the reasons why I chose psychiatry in the initial question you asked was that psychiatry is one of the few specialties still a good quality of work-life balance, right? And in that, it is still one of those specialties where rarely you have to go in the middle of the night, like our surgical colleagues do, for example, and many of the specialties. So I think it's not that hard especially as you get older in a specialty, it gets better because you know your skills, you develop them in a way that you get better at time management. It's not easy, obviously, especially when you have a young family. But overall, I think with lots of help from my family and understanding the nature and demand of my work, we make it work. I think it is manageable. You have to be organized though, right? And you have to make sure that you always leave some wiggle room in your day. Yeah.
Good advice.
Thank you.
What was the most memorable or meaningful patient case you've encountered, and why did it stick with you?
Psychiatry is a very meaningful specialty in that, because you're helping people when they're really vulnerable, and sometimes their life is really in distress, maybe socially, personally, financially, and helping them set that straight can be quite meaningful, rewarding again, but also there is a sense of connection you have with the patient. Then you've shared that, which can be quite a lasting impression on both of your lives. Sometimes there'll be many cases, I think, which I've really enjoyed working for such patients or with them. Some of the times when patients are manic, they do things that can be very, I guess, memorable in many ways. One of my patients, I remember, he stood in the motorway and gave a random guy £20,000 of his own money, and apparently the other guy just took it and drove off to everybody's surprise.
Yeah.
The same guy once jumped from a passenger ferry because he thought he could fly.
Oh God, it's a bit dangerous.
Yes.
Sure. Yeah.
And then we've had some very dangerous patients. I've been stalked before once, so I had to wear an alarm all through the town center in the for many months. I think there was a patient who was a young mother, and she was very unwell. She thought that she could never love her child, and by the end of the admission, the day that she thanked me with her baby in her arms and thanking me for feeling the love for her child, I think that still lasted with me for a very long time.
That's such a beautiful feeling.
Yeah, it was. And as I said, all the work is meaningful and memorable, but some of them obviously, you leaves a mark in your mind.
Definitely, yes. Thank you for sharing.
You're welcome.
What are some misconceptions people have about psychiatry?
Oh, well, where to start? It depends on who's asking, really. I think in my experience, when often new doctors come into psychiatry, they think it's quite a relaxed field of work and they take it quite easy, while it's not. It's actually can be quite taxing mentally, physically. It's a busy specialty, ultimately.
Definitely.
There are not enough of us around, psychiatrists. People believe that mental health medications are addictive, or due to the media, there's a lot of negative publicity for psychiatric treatments because the negative portrayal of such treatments in the community. Could you think of a psychiatric treatment that has a very negative publicity, for example? Think movies and Hollywood. So electroshock therapy,
Yeah.
right? And actually, it's quite a safe treatment. Patients are asleep when they're given the therapy, the treatment. They don't remember any of it, and it's quite good in terms of help as a treatment in helping people with severe depression or psychosis, etc. But because of the media, people may think that this is a very brutal, barbaric treatment. I think that's probably the most commonest one in the way of psychiatric medications causing either too many side effects that are not there, or that psychiatric treatments could be inhumane. Yeah.
That makes sense. Unfortunate, but
Yes.
Yeah.
Well,
how do you handle emotionally heavy cases and avoid burnout while working in psychiatry?
I think avoiding burnout is now, a skill that one must have in any specialty, in any field of work, really. In emotionally heavy cases, there is, in psychiatry we have these groups called Ballant groups. Okay, so Michael Ballant was a GP who started these groups where psychiatrists can sit down and talk about the impact of the cases, negative or positive, amongst their peers. Those groups and such outlets really help in dealing with such problems. The good thing about psychiatry is you're also working in teams, right? So you can also have discussions with your colleagues about such situations. It's always helpful. Now, burnout, I think there are multifactorial problems to burnout, and maintaining a good routine at work, making sure that you have autonomy, to not overwork, give yourself consistent breaks. All those things are important in understanding, right? And ultimately, healthy body is healthy mind, right?
Definitely.
So finding hobbies and activities outside of work, all those factors I think contribute in avoiding it. So yeah.
Yeah, I never knew about those groups, Ray. It was a good insight.
Yeah, thank you.
In your opinion, how has psychiatry changed over the last few years?
It has changed quite a bit, and it is changing. Psychiatry still is not a very old specialty, Previously, I think up till the 50s, psychiatry was under neurology, right? And then psychiatry became a branch of medicine separately. And in that time, it's changed a lot. As I said, multiple treatments, new treatments have come up, new antidepressants. There's a lot of research happening in psychiatry now. So psychedelics have come up in psychiatry as a form of treatment. Mental health apps can provide lots of support to patients for self-help strategies. There are transmagnetic stimulation, RTMS, and genomic treatment research, and there's telehealth now as well for psychiatry, which didn't used to exist before. And of course, the use of AI in managing patient care for multiple facets is now coming to the fore. It's changing quite quickly, I think, from how it was when it started.
So it's an ever-evolving field.
It is, yeah.
Do you ever see AI taking over psychiatry entirely, or is that something you don't think is going to happen?
Well, it's a difficult question to answer because we don't know the full scope of how this AI will go, and I don't want to be the guy who has egg on his face when there are no psychiatrists in 50 years' time and there's just AI. Personally, though, I find it hard because, the nature of psychiatry is very much based on human connection. And as much as you could talk to a computer, chat to an AI, it does not have the same connection. So AI would transform it, I'm sure. It's already helping us in documentation, in patient management in multiple ways. I don't see it taking over.
It doesn't have the emotional maturity.
That's a big factor, yes. And there are multiple decisions that you have to make that are beyond guidelines, that are very complicated patient management issues, lots of gray area decisions that you have to make. And personally, at the moment, I don't see it taking over.
That's a relief. Good to hear that.
Yeah, well, good for us.
Yes, definitely. What are the different subspecialties in psychiatry? Any unique ones you would like to share?
So psychiatry has many different subspecialties people don't know. So I myself am a general adult and liaison psychiatrist, which means that I look at adult age patients from after their teenage to before they become old age, which is 65 and over. There's forensic psychiatry, there is substance use or addiction psychiatry, there is rehabilitation psychiatry, there's of course child psychiatry, and there is older age psychiatry. And there are other subspecialties now like perinatal psychiatry for women who are expecting a child or during the pre or postnatal period when they have a psychiatric problem. So there are quite a few, and right now I think prenatal psychiatry is on the rise. People are really looking at developing that. So that's good. And as I said, my own psychiatry consultation liaison is a subspecialty is very good because you can work at a general hospital outside of a psychiatric hospital, where you work in a hospital seeing psychiatric patients or patients with psychiatric problems while they're admitted for a medical cause. So say a patient may be admitted for an operation and they have a relapse of psychosis, for example, or depression, and then I would go and see them.
Oh, that's very nice. So often you'll have like psychiatrists who work like in psych wards. Is that like a different speciality or?
So general adult psychiatrists would work in psych wards.
Oh, okay.
So would say a child psychiatrist or an older psychiatrist. Psychiatrists can work in various places. You know, they would work in an inpatient ward. They could work as in a clinic, or they could work in forensic units, which is also
that's
quite an
pretty cool.
interesting
Yeah,
place, right?
definitely. So to conclude, I would just like to ask: is there any advice you would give to like high school students, early college students wanting to pursue a career in psychiatry or medicine, either one?
Well, you know, medicine is a lifestyle choice. It has its ups and downs like any other profession. I say to most young people that I meet that it's a very rewarding specialty, but you need to be passionate about what it is and what you're getting into, because it does ask a lot back too. So it's a lifelong learning activity. You have to go through lots of hoops, pass lots of exams. Ultimately, it's competitive, and you have to keep that in mind. It's the nature of the specialty. But having said all that, it is rewarding, and it can provide you with a variety and social feedback and satisfaction that perhaps not many other professions can provide. Psychiatry is a lovely specialty to join. I think in medical college, if people like psychiatry, they should definitely do more electives in it, and that would be something that would open their mind up to the specialty itself. I advise it to all the medical students that whatever they want to subspecialize in, they should definitely spend some time in that specialty and look at if this is for them or not. And there's always room for change. If you don't like something, you can always do something else. And that's the beauty of medicine. It's got so many avenues to choose from. I hope I answered that in a roundabout manner,
yes.
right?
What a great answer. Thank you so much.
Thank you so much for having me on your podcast.
Yeah. Thank you.